If you can nail your patient experience where it's seamless, even though you feel like it's chaotic, if the patient doesn't feel like it's chaotic, then nothing really matters.
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a data dental nerd and your host.
Welcome, everyone, to another Growth in Dentistry podcast. I'm super excited today. Today is going to be a deep dive episode. These are some of my absolute favorite because we get the chance to talk with actual professionals within dentistry that are just like you, dentists, office managers, owners that are in the trenches trying to figure out how to be successful as the world changes around us, as costs go up, as cost of team members go up, as reimbursements from insurance companies continue to stay flat. Like, how do we engineer a successful business that can take care of our team that also allows us to provide a high level of care to our patients that we want to provide? So super excited for today. Before we jump in, though, and I introduce the actual guests, always I have to give a shout out to the marketing team at Dental Intelligence for sponsoring this podcast. Grateful for all the work they do. As always, they have an offer where if you'll get a demo of Dental Intelligence, they'll give you a $50 gift card just for checking it out. There's cool stuff coming out of the time. So if it's been a while since you've looked at DI, or if you've never looked at it, definitely come and check it out. Now, without any further ado, I want to introduce our guest today. So we've got Kirk Teachout. We also have Zach Shelley. These are personal friends at this point. I hope you guys are okay with me saying that, of both Adam and I. They're good dudes. Kirk has a background in the music industry. We were joking before that one of his business partners dated Taylor Swift. So it's basically like he was business partners with, what's his face? The Chiefs guy. This is terrible that I'm forgetting his name. Travis Kelce, that's right. No, just kidding. He wasn't business partners with him, but he's got a really cool, exciting past in the music industry, and brings a really cool, unique, and new perspective into dentistry that I find really refreshing. His wife is a full-time dentist, and their practice is among the top 10% of performing practices within the Dental Intelligence user base. And then Zach is also a personal friend. Zach not only has big fish stories, but he's got the pictures to prove it. He's a great angler, and we met Zach. Did we meet at ADOM? Is that where we like originally met?
Yep.
I think in person.
Yeah.
So quickly hit it off and became great friends. He's a phenomenal dad. So is Kirk. And then Zach's involved in running both a pediatric practice and a GP practice. And the GP practice has 3 doctors. Pediatric one has 2. And he brings a really interesting perspective as well. So between these two, we're excited for the conversation we're going to have today. I'll give one plug to listeners, just so everyone knows this coming in. Kirk has recently started consulting. So as you listen to him, if you're like, hey, I want to engage with this guy and get some of the systems that he's talking to, absolutely, we're going to throw his website in the show notes. And then the same thing, Zach has started a Facebook community that's just exploding. Like, it's so fun to see just thousands of people coming and jumping in, wanting to be involved in the conversation. So if you want to jump in and be a part of a group where you can talk openly about how to create a successful dental practice, problems that are being solved as office managers and owners, then come jump into Zach's group on Facebook. We'll also throw that in the show notes as well. Okay, so now Zach and Kirk, welcome to the show. Say hello to everyone.
Hey.
How's it going, everybody? Glad to be here.
Yeah, I love it. Oh, and then context. Zach is out in Florida, and Kirk, this is terrible, but I'm not remembering even where you live. So remind me.
Tennessee.
In
Memphis, Tennessee.
Memphis. Oh, that makes sense why your old business partner maybe had some youthful connection to Taylor Swift.
Yeah.
I like it. So here's the deal. I want to start high level with both of you. You both are running really high performing practices, and I want to get into the nitty-gritty at some point. I want to get into some operations, some systems, like what are some practical, tactical takeaways people can have. But where I want to start is like high level. I want you guys to kind of talk through, as you look at your practice high level, what are the metrics or numbers that you look at to know, like, hey, are we going in the right direction? Are we not going in the right direction? That you feel like give a really good pulse on the business. And let's start there high level and then go down into some of the operations. Like, okay, if it's not going in a great direction, or if we want to make it get better, what do we actually do to improve it? So let's start high level.
You go first, Zach.
Sweet.
Oh, thanks for throwing me under the bus, Kirk. So high level, we go through every single month. I have an extensive report. I talk with the owners of practice health and growth comparisons from year to date, for this year versus last year to previous year. And Dental Intel does an extremely good job of saving me hours of work. I'm able to put together. It's roughly a 6 to 10 page report that does not take me days and days and days to compile all this data, which in turn the owners absolutely love because they can come in, we can sit down, we can look at all the reports, and then we can discuss, because the numbers are all in front of us. A lot of things I look at, high level, just bird's eye view of the practice growth. One of our biggest things that I love, Dental Intel does a great job as our patient growth chart. So you're looking at the new patients, but also the attrition rate. I think this is one of the biggest struggles that offices look at. They're like, man, I got 100 new patients this month. And I can tell you 90% of the people I ask, how many patients did you lose this month? They're like, I have no clue.
Well, yeah.
And then they just swallow a rock. And I'm like, yeah, it's a problem. You don't know that. So you don't even know if your practice is growing. So that's one of the biggest things I look at is our growth, who we've lost to inactivity or actually physically left the practice, who we've reactivated alongside our new patients. That's also huge wins of knowing our team's actually reactivating patients that did not have an appointment within the last 18 months. And then feeding off of that, and then I'll steer to you, Kirk, and let you dive on another KPI, is the new patient reappointment rate, which I think is another huge number to look at, because if we're bringing all these new patients in, are they actually going to stay with you? Did you make an impact on that when they came into the practice? They actually want to come back and see the doctor for treatment or their follow-up cleaning.
Which I'll just say too, the new patient one is one that I've thought for years. It's like, man, I wish we could get the whole industry to like hyper focus on that, because the average practice is only getting about half of their new patients to say yes to the next appointment. And of course, after that first appointment, they go scoop a few more up. But yeah, new patient retention across the whole industry, I would wish it would go way up. Like for our business, I can't imagine having a bunch of new people sign up and then losing like 35% of them like almost immediately. That's not a fun way to grow. So I love that. That's another good call out. All right, Kirk, let's hear what you've got.
It's not, but I'm going to play devil's advocate with that. So
Okay, yeah, please do.
Here we go.
I personally do not mind a 35% attrition rate. The reason for it is because we focus so heavily on our ideal patient.
Yeah.
So the reason why our numbers are so great is because we fire patients. And whether that's quietly dismissing them or actually physically dismissing them, even in that first appointment in the chair, we have a standard in our office and a principle that goes through the whole office with the vision that is just like, look, it's not just the patient that we hold them to that standard, but we also hold ourselves, leadership, to that standard, and our team to that standard. And no matter who it is, we will have those discussions with them. So if somebody's in the chair and they don't want to take x-rays because they think they're going to die of cancer, or they just don't accept the fact that their teeth are rotting out, it's like, look, I'm sorry, but I'm not going to push this on you, but that is your choice. But I think that maybe somewhere else is the best option for you, because I'm not going to do something, one, that you want us to do that's unethical, and two, I'm not going to do something that really is, neglect to what your actual health needs. So
I'm actually interested. Do you have like any, because I'm sure there are some of those, like they want to see like a more holistic dentist, and I think there's a path for that. In fact, I had a doctor on maybe a year and a half ago who runs a really cool, like more holistic practice, or like that's totally his vibe. And so I wondered if you have like, do you like know some local practices where you're like, hey, like this is gonna, or you just like let them go find
I just let them go find them.
Like,
I mean, at the end of, yeah, I mean, so one thing I think is super cool about what we do, as a little side note here, is that, we're a heavy PPO practice. We only work 3 days a week. We are in a rural area. So, and we don't do dentures in a rural area. Like there's so many things, high digital
that's one
dentistry.
thing I didn't call out. You guys aren't doing like big, massive cases. Like you're doing traditional, conservative, general dentistry. Yep.
Yeah. We lay out the options
very successfully. Yeah.
Yeah. And so we just lay out the options, let the patient give us the answer, and then we go from there. So yeah, we're not super aggressive. We're very conservative, but we also provide the best care possible. And so when we approach this, the reason why our numbers are so high in so many metrics is because we focus on that ideal patient. So I want to bring it back to that so we don't get too far on a tangent.
Yeah, great.
But we focus on that ideal patient. So even if I have 50 new patients this month and I technically only net maybe 15 to 20, I'm going to do much more out of those 15 to 20 than I will out of the whole 50, just
Mhm.
because we go deep with those few that actually are the ideal patient because they trust us, they are motivated and want to actually do the treatment that we suggest.
Mhm.
So this is why this podcast is going to be fun, because your practices are both wildly successful, but so different.
Mhm.
Yeah.
Zach, you're pumping 10,000 active patients through your practice. Kirk, you're hey, let's focus on active patient or on ideal patients. And so you're running boutique while Zach's running volume, and you're both getting really, really good results. So it's going to be fun to look at the metrics that both of you are focusing on.
Mhm.
And exactly, there are different ways to cut the apple, right?
Mhm.
Skin a cat is
Absolutely.
another
I
way
was
to
gonna
put
say,
Just skin a cat.
it.
Like,
Yes.
no.
that's kind of
No,
that phrase should
no,
probably not exist, but
Yeah.
no
Yeah.
animals
It's
were
like
harmed in
I've
the
I've like
recording of
tried to
this.
figure out how to say kill two birds with one stone in a different way because I'm like, why not like me out here killing birds? So
Well,
um,
listen, just no animals were harmed in the filming of this
yeah,
deep
none,
dive.
zero,
Okay,
please.
none.
So
Um,
Kirk, do you want to riff for a second? I didn't get I
Yeah.
want to hear an answer. I want to hear like metrics. I got a couple from Zach. I want
Yeah.
to hear several from you, like high level as you think about the business. What are some of those key metrics you look at and why? And then let's start diving down into some more of your guys' thoughts.
Steve, can
Sure.
I
Yeah.
Yeah,
just do one thing really quick because
yeah, for sure.
I want people to understand what Kirk is saying.
Mm-hmm.
Because of us running two widely different practices, doesn't Kirk's system works a very efficient, effective way.
Yeah.
Even though he's okay with that, say 35% attrition rate, that is healthy for his practice and the way he runs it
Mm-hmm.
because he's aware of that attrition rate and he's aware of what he needs to do for his patients
Yeah.
in order to get the treatment acceptance they need.
Mm-hmm.
So that is what differentiates him from all the other practices of the same size, is because he knows exactly who's coming in his door and who's going out. The
Yeah, and that's
practices
not
that need
haphazard.
to,
That's good. It's very intentional.
it's exactly. So intentionality plays a big role in that. So I just
Yeah.
wanted to kind of put that point out there for people to understand what Kirk does very, very well. And it's super intentional how he does it.
Yeah, that's a really good call out. Yeah. All right, Kirk, let's hear some metrics. I want to hear.
Yeah. Hey, I'm cool with that. Yeah. So there are 5 main metrics that I look at every single month. And Dental Intel does an amazing job of, like Zach said earlier, of just laying it out. And that's why I love DI, because, and that's the reason why I want all my clients to have DI, just because it's so simple, and simplicity is the way that we can scale and actually do better in our businesses. And so those 5 key metrics that I look at is, one is hygiene reappointment, like we've kind of talked about. It's like, yeah, I mean, hygiene reappointment is the number one, but
Yep.
you know, where a lot of people are like, oh, I want to see 98% reappointment. Well, once again, I'm looking at key ideal patients. So I may have a 90% reappointment rate, but that's once again intentional. I typically run around 90 to 92%. Now that's okay with me because once again, I may not want all of these new patients because they're not going to trust us. They're only going to come in for emergencies when their tooth is hurting, and you know they may not want to do the treatment in general, and that is okay. There is a practice for somebody out there for all these people. But that's number one. Hygiene reappointment. Always look at that. I want to see that from our hygiene department and try to keep it healthy that way. The second is treatment acceptance rate. Now, that's an easy one to figure out, which is just simply, hey, you present 10 fillings, they accept one, that's 100% treatment acceptance rate. So, you know, if you're presenting treatment, they're at least trusting you enough to move forward with something.
Indicate. Yeah.
Yeah, in the case in general. But to go a deeper, the third one that I look at is that treatment acceptance percentage,
Mm-hmm.
which if we're going deeper is like with those 10 fillings, if they only accept one of those fillings moving forward, that's a 10% treatment acceptance percentage.
Mm-hmm.
And I want to see 70, 80, 90% treatment acceptance percentage, which I think the average is what, 35%, something like that.
Yeah, somewhere in that ballpark. Yeah, it's around
Low,
Yeah.
yeah.
Yeah. And so my wife, traditionally, like I know I was just looking at this metric the other day. Like she presented $100,000 of treatment and $87,000 of that was accepted.
Huge,
I don't know if listeners know, but
huge.
that's like incredible.
Yeah.
Like I think to get into the top 10%, I think it's 54-ish%
Sure.
of the total treatment case you're presenting, getting, 54% of those dollars of that whole case completed. So that's like really
Well,
awesome.
so, but once again, like going back to the ideal patient,
Yep.
when you have the ideal patient that trusts you and
Mm,
trusts your team, you have an amazing patient experience, like we talked about on the last podcast. People want to do the work. They're not insurance driven. Even though they have insurance, they're willing to do the work because they
mhm.
want to get 100% healthy. So I still look at that treatment acceptance percentage. Now, I do want to put a disclaimer out there. We don't do 88% every single month. That's not
Yeah.
that's not what we do. But still, it's possible, which is
Yeah.
so cool. Now,
Mhm.
we typically will run around that 60 to 70%, which is still higher than normal,
Yep.
but it's because we focus on that ideal patient. But what's cool is our associate, who is a new grad last year that started with us, is in that 50 to 60% range too.
Yeah, which that's pretty awesome to come out of school and be in like that top 10% of providers with, the case dollars accepted. That's pretty impressive.
Right. Which
Which
to
tells me
me,
there's like a systems element to this and training element.
yes,
Yeah.
exactly. So I personally believe that the actual treatment acceptance percentage is only about 10% the doctor.
Mm-hmm.
I believe you do need to be a great communicator and you do need to be able to explain treatment, but I believe that your team needs to really pull the load there. So that way the patient understands because they spend more time with your team than they
Yeah.
do with the provider.
Yep.
So now when the provider comes in, they're just essentially confirming, which is what their license allows them to do, and say, look, yes, I agree with this. Did they explain that well? Awesome. And then they're like, do you have any other questions? And then you get into the technical terms and building that relationship personally versus doing this massive explanation that they're not going to remember.
Mm-hmm.
So to
Kirk,
me, I think that that's probably, and we can get in the weeds on that, but but I want to get back to that. I do believe that that is the system that really breaks down. Everybody tries to just be a better communicator, and I do believe you need to be, but I think it's a breakdown in your system leading up to the provider coming in as to why that doesn't happen.
yeah,
Mm.
I want to chime in on that too, Kirk, before you get into
Yeah.
4 and 5. Um, Everybody listening will start realizing that Kirk and I will pick a lot of the same metrics, because when you get on this level of operation, the metrics aren't going to change what's going to make the practice successful, no matter the size, whether you have one provider or 100 providers. You're going to be looking at these metrics are key metrics that are going to cause your practice to grow, not only just grow in volume, but grow in strength and stability of having a strong practice. And when he's talking about this treatment plan acceptance, he's 100% true. It's the same thing in our practice where you have strong team members that build this connection with the patient. They're reinforcing and educating the patient and understanding why this treatment's important and what it's going to do for them. And then when the provider comes in, what I love is Dr. Calderon will come in and he'll talk to the patient and say, okay, I'll see you back for that crown. And that's the last thing he says to the patient before he walks out of that room. They're like, oh, he needs to see me back. That's all they remember. They're like, all right, we're ready. Go ahead and schedule that for you. Perfect. Yeah, I want to get that done because he said I need to get it done. So it's that culmination of the team all working together. But you have strong hygienists and strong assistants in the forefront of that, building that relationship. That's only going to just continue to do this with your treatment plan, percentage acceptance, dollar acceptance. And that's why you're seeing 87% in a given month over 100 grand, is because these patients know it's important. I think that's one of the biggest things we miss in dentistry is educating our patients why they need to get something done. A lot of times like, oh, you need 4 fillings. You want to get those done? Like, why? Like, what's
Mhm.
going on? Like, where are you finding this? You see those little dots on that picture there? Nope, I don't. They don't understand. They don't understand why they need it. But if you actually take a moment and get them to understand on their level why it's important to get it done, I mean, you go in to see a cardiologist, they're going to explain to you, I have to put a stent in your heart because you only have 30% blood flow in this artery. And if I don't do it, you're going to die. Like, dentistry is not that deep. I get it. But there are so many other things that can happen if we're not healthy in our mouth. And it's the gateway to our entire health of knowing what's going on. So we need to be on the forefront of that education. And the byproduct of that is great treatment plan acceptance.
Yeah, I love that.
And to piggyback even off of what you're saying there. So, right. So I feel like even you missed the last part of that portion of the team, which is the front.
Yeah.
So your front arguably closes just as much as your clinical team, because your clinical team could have that patient sold on that treatment. And if they don't get scheduled because the front's not as good, then it doesn't matter, because at that point it's not closed. If it's not
100%.
on the schedule, it's not accepted. So that's something that, you know, like we talked about, I hired 2 brand new, no experience front desk. And within the last 5 weeks, they're already closing all of that treatment from the front and getting them on the schedule efficiently. And so it's like, okay, we have the trust. They know, like what Zach was saying, like, hey, I would look forward to seeing you for that crown. Well, the last thing after giving the estimate for the front, and I'm so particular on this phrase, is when is the best time to get that scheduled? Not
Yep.
would you like to get that scheduled?
Yep.
Because that's giving them an out.
Yep.
Okay. So if you just say, when is the best time to get that scheduled? If they don't want to do it, they will tell you, and that's fine. But if you give them an out and just say, there's the door, then they're not going to do it in general. And so
I
the
want to
goal
sit
is
here and role play and see if I can evade you. You're like, when's the best time to schedule? Probably after I talk with my wife. And then
right.
I just kidding.
Yeah. Yeah. Well,
Well, no,
and
you
there's
got a
so
great
many
point.
things there.
Yeah.
Yeah.
I do that all the time though, Steve. There's a great out on that too. Not a problem. Let me go ahead and hold a spot for you in 2 weeks.
Yes.
And when you get home, if it doesn't work for you, give me a call back and we'll move it to another appointment time. Like we will put Kirk and I to the test. We'll get you on the schedule.
Yeah,
Steve.
I know. That's why I want to do it, because I'm like, I know you guys. Like listeners start to hear the things you guys do, it's like they're like, oh, that's how you overcome that objection and just get to the outcome you're looking for. You know, that's best.
Well, and as a doctor too, like, you know, Zach has that thing that they say at the very end, the providers say, but something that I also, if the front's doing their job, but the patient still is not, you know, getting on the schedule, then I'm like, okay, so let's go back to the doctor. So the last thing that the doctor should ask too, as a tip, just to try to help the front anyway, get them on the schedule, is, you know, the last question they ask is this, which is just, besides finances, is there anything that will prevent you from moving forward with this treatment?
Perfect.
Gold.
And the reason why is because that takes away all objections minus the financial one.
Yep.
So that way in the front, the only objection that they're going to have to combat is the financial one. So as long as they can figure that out, then, and now with payment plans with engagement, I have already authorized my front desk. I'm like, hey, no new patients because we haven't built trust yet. But if they are kind of scoffing at the price, you have authorization for a 2 or 3 pay. So we close that treatment. But at that point, once again, it's just a financial, you know, objection at the front. So that really narrows it down to get it on the schedule.
Yeah, that's such a golden nugget. Isolating, is there anything outside of finances that would stop you from getting this scheduled or moving forward? I don't remember the exact phrase you used, but that is brilliant. Brilliant.
Yeah. Well, it goes back into Kirk's learn the way to read a patient, learn about them to form the ideal patient. Like this is part of it, you know, getting to be able to read them and figure out what the barriers are. You break those barriers, the sky's the limit.
Yeah, what I love about you two is you guys can't help yourselves from just diving into the mechanics of how these all work without getting through the metrics. It's so good. It's like, well, I said the metrics, so I gotta just share it. So good.
I just gotta give it to you. I just can't. Yeah. Okay.
Let's hear your last 2 metrics, and then we keep diving in. You know, let's hear your other 2. So I've got from you hygiene reappointment, patient case acceptance. Like, do they say yes to some part of the case? Treatment case acceptance, like on the dollars, like how much of that case? You mentioned like 1 out of 10 fillings or 8 out of 10 fillings. Like how much did they actually say yes to? And what are the last 2 you like to look at? You mentioned you had 5.
So like we've talked about, right, is new patient growth. Like I like seeing new patient growth. You know, the average I think is like 25 new patients, 20 to 25 new patients across the country. I like to see 40 to 50, depending on like the size that we are, that $1 million to $2 million practice. I like to see 50 as healthy. Just because if you get above that, then you're probably seeing a lot going out the door and you're not really focusing on who's coming in. But if you're seeing less than that, then you're probably running through all of your treatment. And so you're probably looking a little lean on the doctor side. So I like that 40 to 50 new patient growth metric, which is something I look at a lot of. And then finally, number 5 is the collection percentage.
Yeah.
So I got to look at the collection percentage, which I was looking at it not too long ago, and we were actually so the average, like you want to be at 98%, right?
Yeah.
We're at 115%.
Yeah. Talk us through how that works. Because in general, if you collect 100%, that means I collected all the dollars that of dentistry I did. So talk us through 115.
It's
I
called
see it all
skimming
the
off
time.
the
So
top. Okay. No. No.
that
So what that
includes
is.
tips. So we actually just
Yes.
turn it over and we say, "Okay, how would you like to pay today?" It's got the 50% tip on there.
Right.
I'm
Right.
just
So we have that the DI payments now have the tipping option. So we can do that.
This is a joke. This is a joke. Okay, for everyone listening, that's not
No,
how
yeah.
it's going to 115%.
There is, yeah. But no, Dan's gonna kill me when he hears this. But no, so no, what we do is, and this kind of ebbs and flows. We don't always do this, but we're getting back to it where, especially, everybody talks about Sucktember, Sucktober, like whatever you want to call it, is like, okay, when people start canceling on you last minute, even though we always tell them like, hey, totally fine if you need to reschedule this, just give me 2 days. So that way we can respect your time, we can respect other people's times, and we can get them in. But as that starts becoming a trend again, I'm like, okay, look, I need a $50 deposit that goes towards your work and your part for that day, but we are going to need that to get you on the schedule. So we start doing that, and around this time of the year, because it's a trend, right? People start canceling a lot more often and moving around last minute. So one, we have a $50 no-show cancellation fee. Well, that takes care of it. I don't have to chase people, and then they have to make another deposit to get back on the schedule. But that's the reason why we run above 100% right now, is because we take deposits for almost all work. And then we also take, if it's an hour appointment on hygiene side, I have a $50 thing there. So with deep cleanings, we have a $100 deposit that goes towards their spot.
Another common thing I'll just mention I see all the time when we get over 100 is if I've been collecting between like 95 and 98%, that means there is every month, 2 to 5% of collections that are kind of like building up a pool. And it's pretty common for folks at certain times of the year to do like a little bit of like a collections, like hyper focus. We're like, I'm just going to go try to like clean as much of this up as I can. And so then in those months, I'll see their collections percentage come up above 100 because we're looking at how much did we collect in this month in comparison to the production or collections for that month. And so then sometimes we will collect above in certain months as we go through like a cleanup process, which is like pretty common. Sometimes I'll even see, depending on the team, sometimes by the time they get connected with us at Dental Intelligence, they'll like have not really done cleanup for years. So like in that first year of working with us, all of a sudden their collections percentage is like 108, 110, like consistently. But then once they work through, most of those past due claims or, accounts aging from the patients, then we'll get back to that, nice, healthy 98 to 100-ish%. So,
Yeah.
but then, that's interesting. Go ahead, Zach.
So I want to bounce off that collections percentage. Is we tend to run a bit in between 99 to 101% due to reasons, like you said. But another number that I love to look at, especially with the scale and size of our practice, is our AR days.
Explain that, because a lot of folks may not know what that exactly means. So go ahead.
So it's the average amount of days that you're able to collect on your money. When you're a PPO driven office, it says 45 days or less, which is high for me.
It is high.
We sit around 26 to 28 days, which in my opinion is just over 3 weeks on average that we are to collect our money, which That is 99% of the time going to be the case for insurance. We are also a VA provider, and you know as well as anybody else working with insurances and then put government on top of that, it's not easy to get your money sometimes. So with the scale and size, that's one thing I use as a checks and balances for my insurance and billing coordinator that's running all of these claims and making sure that they're being paid on time, that I can get a quick snapshot and look at it and say, yes, we are sitting where we need to. We are getting our monies in. Like I can look at those two numbers, collections percentage and our AR days, and not have to really run any other reports to know that I'm healthy at the moment. Doesn't mean I don't look at anything else, but I can get a glance at it and know, okay, we're doing good right now. And like you mentioned, Kirk, September, and you know, people having struggle months during that, and it's interesting that you know, size of practice does kind of change that a little bit, but also the type of practice also changes that a bit too. So like for us running a general pedo practice, you know, we do see an influx in this time of the year, especially on the pedo side, because school has already started, kids are starting to settle down. So then parents are more
All
likely
that
to schedule
Halloween
these
candy,
kids.
kids are getting
Yep.
sugar bugs.
Heck yeah. So
Probably though, actually, right?
yeah.
I don't
Yeah.
know how fast you can develop cavities, but kids sleeping with milk duds on their teeth for a couple of months will cause some problems.
Yeah,
You
for sure. So
know?
I just want to make note of, like, you know, the type of your practice will determine what the year, you know, will look like. And inherently you will have a month that's lower than others. Every
Yeah.
business is going to have it. There's no way you're going to produce, 500 grand every single month, 600 grand every single month and not have any waiver. That's not a normal practice. And if you're able to do that, let me know, because it'd be really nice to just be able to pinpoint your number every single month.
I can
Um,
show you how to do that.
Oh, perfect. Thanks. You have
Attaboy.
you have an Excel sheet on that for me, Kirk. You can email that right
Sure.
over to me.
Sounds
Perfect.
great.
Thanks.
Interesting
But
thing is
yeah,
you guys both have such a great pulse on your numbers. You
Yeah.
probably mitigate a lot of the cyclicality that some practices see.
Yeah.
So cyclicality in dentistry is actually perpetual, right? Like if I have a down September, well, even if I schedule 80% of those patients back, 90% of those patients back, guess what? That's 90% of a down month that's coming back 6 months from
That shows up in April.
and then a
Yeah.
year from now. And so if I
mhm,
don't have a pulse on that and know, hey, I need to buffer this and make sure we get back up in this month
Hmm.
and push more into September or pull out of October into September, but watching your numbers on a regular basis avoids some of that cyclicality that happens because you can strategize around mitigating that.
100%. I talk about this all the time with a lot of people, because some people like, I only look at my numbers quarterly, or I look at them like yearly, or I look at them only when my P&L comes out. And I'm like, you're too late. Like you should be looking at your numbers every day. You should be looking at weekly trends. You should be looking what's forecasted for the week coming up. And if you're not doing that, doesn't mean you're doing a bad job. Don't get me wrong. But in my personal opinion, there's way more you can do to make your practice way more successful. And also, like you said, Adam, mitigate that cyclical behavior in the practice and say, you know what, I'm going to make my September good because I know what's coming. I know what's on the schedule and I know what I need to do. So you can figure out, do I need to give myself more time to fill October, and say, hey, I can see you get these crowns in September, and bulk up your September, because you know it's not as hard to get patients in October. And once again, there's more time to get the patients that aspect of time frame. But looking at your numbers, you hit the nail on the head, Adam, is like you constantly looking at your numbers. So that's another thing that Dental Intel, the feature of scorecards, is amazing, is because you can look at weekly trends back to back to back and really get a feel of like how your month is going and catch it before it changes.
Hmm. One of the things I'll comment as well, like as I was listening to you talk, Zach, like the way that you're thinking through managing the business also allows you to be like your success is far more predictable, and you feel like,
Mhm.
okay, I know what levers to pull when certain things happen. So a lot of folks I think that are out there are managing the business far more reactively. So they kind of like wait
Yeah.
for problems to happen and then they like will solve in the moment. And I think just from like a person to person, like friend to friend, that's like not a fun way to live life.
No.
Like you live in this place where it's like I think a lot of times work would feel overwhelming in that situation. It would feel like it's just a lot all the time. Where if you can have a little bit of a better grasp on the mechanics of the business, what are some of these numbers I'm tracking and levers I can pull when one goes up or down and I need to make adjustments, then you feel far more like in control, which just is like a nicer way to live. You know, like all of a sudden work can feel more exciting. We're like, I know what to do when this thing happens because I've seen it before. And so we're going to take this path. Does that make sense?
Yeah. Yeah, 100%. And it's like all I can think of in my mind is the old school Looney Tune cartoons where it's like the boat's got a hole in it and you plug the one finger in the hole and then another one bursts in. So you plug your finger in that hole and then you're like finding yourself, you're like, okay, I have no more fingers. So I'm starting to try to use my feet. And you're like you said, it's that reactive behavior and you don't know which hole's going to pop next. So like you're trying to manage that and mitigate it. Whereas you could have prepped this before the boat got wet and then you're
Hmm.
not having to deal with it. You just sail through and doesn't mean things will be easy, but they're more predictable. And like
Yeah.
you said, you can pull the lever you need to pull, flip the switch you need to flip, rather than I don't know what to do and my job depends on it right now, or my bonus depends on it, or my doctor's going to be
Mhm.
pissed if he finds out we're down 20% this month and I don't know why. So it allows you to have that insight on your numbers and on the practice where you can be confident moving forward. And it also, going into the other aspect of it, is allow you to be a better leader in going through it because you're not stressing about not knowing what's causing this.
Hmm. Now, I don't know if this is like a good place. I'm looking at time. We've got maybe like 5 to 7 minutes. I think it'd be cool to almost do like a speed round, like between the two of you, like tips and tricks. Like if you guys could kind of just like spitball, like, hey, here's some cool phrases, or here's some cool things that like I just have found really helpful on like my day to day, or my team members find really helpful. If you don't mind, like, is that cool? Can we do that? Like, we got some high level numbers we look at and kind of why, and can we just spitball some like practical, cool tips for a minute? I think that'd be
Yeah.
fun.
That was the only reason why I went to the principal's office in 7th grade was because of a spitball. So let's do it.
Yeah. Nice.
Kirk, you want to go first?
Yeah, I mean, I feel like I gave a ton of those gold nuggets, like with
Yes.
the doctors, ending with that question, the front with that specific question, like when is a better
Yep.
time to get this scheduled. But I mean, there's so many things, and to me, it's it's simple things, right? So really coming back to the patient experience, I know you've seen these trends, Steve and Adam, with these practices, and I've seen the trends with other practices too. It's just like if you can nail your patient experience where it's seamless, even though you feel like it's chaotic, if the patient doesn't feel like it's chaotic, then nothing really matters.
Yep.
So like, for instance, like I wrote it down on a chart and I don't have a whiteboard behind me, but I was training these two new front desks and I was like, look, this is what we want it to look like, where it comes in, they sit down, they're only waiting for maybe 30 seconds, and then we get them back because it's a reception area, not a waiting room. Okay.
Mm.
Mhm.
Medical offices have a waiting room. So we come in, they sit down, they go back to the back, they get their work done, or they have hygiene, whatever, and then they close treatment, they come back, they get their payments, and then they walk out. And it's seamless throughout the whole practice, and everybody's kind. They're saying their name a million times because that's what everybody likes to hear anyway. But they're
Mhm.
interested in what people say. So when people come in, the first thing that somebody in the front will say is their name. Hey, John, how was your week? It's very simple. Like they don't know them,
Yeah.
but it's very simple to look at the schedule and see that there are 4 people coming in and there's a 57-year-old man coming in versus 3 other females. And when that man walks in, you call him John, no
Yeah.
matter if you know it's John or not. Sometimes it's a curveball and it's not John, but still, it's okay. You
Yeah,
say,
take
hey,
the
John.
shot. Yeah.
Yeah, I mean, you just say, "Hey," and just acknowledge their existence. And learn the art of the exit of a conversation without brushing people off too. I would say that's
Mhm.
that's something that's super important as well, because like with doctors especially, when they're in hygiene, there's a timer. Okay? You need to be able to get in and out of that hygiene appointment without making the patient feel rushed, making them feel heard, but still allowing your efficiency to be there, going back and forth, because just like the hygienist hates for them to wait for you to come from your side over to their side to do your checks, your other patients on the other side are waiting for you as well. So every second counts. So something that I would argue is that you need to let every word fight to get out of your mouth. It needs to be super concise. You need to be able to train your team to where they're educating the patient so where you can make connections and really say, yeah, I agree. This is something you need to do. We'll see you soon for that crown, and close that treatment because you're the doctor and what you see, and add anything else that you see. But then you're making those personal connections, transferring that trust, and allowing the patient to continue on throughout the office. But being super efficient is going to be super important with that patient experience.
Yeah, I love that. I was picturing this is a terrible example, but I'm gonna say it anyway. When I was in high school, there was like a 3-month stint where I worked at McDonald's, and every time someone placed an order in the drive-through, there was a little TV with a clock on it, and it would like the second the order was in, then the clock would start, and we like tracked to see like okay, like how long does each order take before we close it out and we get them moving on. And it was like a key metric for our success. So I was just like picturing that. I don't think you need to have a clock in the office, but I love that kind of, hey, we want to make sure maybe each one of those key moments you said in interactions that they're never just like sitting there and feel like they're wasting time too long. I think that's really, really interesting. I've never heard someone talk through it like that. So I like that
Well,
personally.
friction is super like important to figure out. Like where are your
Hmm.
bottlenecks? Where's the friction in the office? So for instance, in the front, when people are leaving, I want the estimates already made. I want it figured out, and I
Hmm.
want the payment to already be up. So that way, when the patient comes up, we have the estimate. Hey, it looks like that crown and those two fillings, your part is only going to be only going to
Hmm.
be 536. When is the best time to get that scheduled? Oh, okay, great. Tuesday in the afternoon or the morning. Okay, cool. So I have on the template on our schedule, like there are 2 spots for crowns and fillings on the afternoon on a Tuesday. Great, cool. 1:30 work for you on the 15th? Awesome. I already have your payment. It looks like you got fluoride. It's $37. You want to go ahead and get, yep, great. Cool. We got it. Got the receipt. They're out the door. And as we're asking them or getting their receipts and everything, we're having a conversation. And we're just asking, well, how's your experience today? So I
Hmm.
asked that question specifically, not did you have a good experience? How was your experience? Because I want them to think, like actually think. I don't want to implant it into their mind. So that way the last thing that they hear and think about is about the experience that they just had, which will skyrocket your reviews as well. If you just ask them about their experience. You don't have to ask them for a review.
That's great. Zach, do you want to give us a couple
Yeah.
Spitfire 2 minutes
All
of
right, let's go.
some tips?
Yeah. So I'll piggyback off the last thing Kirk said. We ask every single patient, "How was your appointment today?" It gives them the opportunity to speak up. It gives them the feeling like you actually care.
Hmm.
Something I did in another podcast that I kind of birthed into something that I do, but I've never vocalized it, and now it's a saying that I'm wanting to share with everybody. So I'm gonna kind of fix. Kirk talked a lot about the patient and the experience and all that. So I'm going to talk more about team alignment and culture and growth and leading your team. And one of the things is I always do check-ins with my team, my associates, everybody. I don't check on. There's a difference. I don't check on like I'm trying to catch them doing something wrong. I check in and asking, what do you need? How can I help you? What do you need for your day? Is there anything that's not working? So remember to check in, not check on your team. And then another one is an acronym I came up with, a couple weeks ago, and it's the LEAD acronym. So we're leading our teams, right? Like we are the forefront of it. They're looking at us for guidance and for growth. So the first one for L is learn and give all of that, what you've learned, to your team so that they can be your best. A lot of times we learn things and we hold it and we don't share it. Why? If
Yeah.
we want them to be as knowledgeable as us so they can be as good as we are, and it makes our job easier. E
Hmm.
is encourage your team and lift them up in everything that you do. Encourage them of saying, hey, I know that was a super difficult conversation, but let me point out the things that you did really well on that, right? Like give them some encouragement. You can find good in everything. But then you can also encourage them with the criticism you're giving them. Like, hey, you didn't do this perfect, but I know you're going to get it, right? Like there's ways that you can work through that to build trust with your team for them to want to do the things that you're asking them to do. And then goes back in the checking on, checking in is ask them what you can do for them so that their job can become easier. Is there anything like, what can I do for you to make your job either more fluid, make the patient experience better? Is there anything I'm doing? I ask in every single employee review, is there anything that I'm doing that's hindering you doing your job? Is there anything that I should be doing better for you that I'm lacking on? And I think it's super important to get that feedback from your team because it feels like they actually have some sort of say of like, I feel comfortable asking that question, so you should feel comfortable answering it back to me, because I want to hear that feedback. And then the last one is deliver on what you say. Intentionality plays a huge role in the practice. And if you say something that you're going to do and you don't do it, you've lost trust. I don't care if the person still says they trust you. They're not going to, because you didn't do what you said you're going to do. So if you're going to do these things, you have to deliver on what you say you're going to do. So those are going to be my nuggets on, I don't know if it was 2 minutes, but close to it, on how to lead your team.
Yeah, that was great. Any final thoughts before we send it off?
No, that was great. Really, really packed 45 minutes of information. We could have gone, I'm sure, for 3 hours.
A couple more hours for sure.
So,
Just got to do it again.
Yeah.
Definitely do it again.
Well, thank you, Zach and Kirk, for joining us today. And then thank you for all the guests, as always, for joining week after week. And we couldn't do this without you. So thanks again. This has been another Growth in Dentistry podcast. Keep growing, and we will talk soon. See you guys.